Hello everyone, my name is Des Wallen and welcome to our series Spotlight Corner at the National Archives at Philadelphia. The series we are talking about here is a very small one, actually only about 3 linear inches, but it contains a lot of information about social issues of that time period. Before we can get into what can be gained from researching these records, let's talk about why they exist in the first place. The Immigration and Naturalization Service had a multitude of responsibilities beyond the naturalization of new citizens, particularly to do with the influx of immigrants and the prevention of poor health amid the population boosts. Such responsibilities prompted the creation of offices and boards to better define such roles. According to the creator description in online public access for the Board of Public Charities, quote, in 1869, the Board of Public Charities was formed to inspect all public and private institutions for the poor, and to report to the Pennsylvania General Assembly on the conditions they found. The Board of Public Charities was abolished in 1921 by a Public Law 1144 number 425. This act created a Department of Public Welfare, abolished the Board of Public Charities, invested all the powers of the board in the Department of Public Welfare, unquote, showing that this was a precursor to some of the mandatory standards we try to implement with such federal agencies as the Department of Health, Education, and Welfare, better known today as the Department of Health and Human Services. And now, the series itself is made up of reports from 2 Pennsylvania locations, the Eastern State Penitentiary in Philadelphia and the Western State Penitentiary in Pittsburgh. There are 4 reports from each dated December 1885, March 1886, June 1886, and September 1886. The reports analyze the state of current inmates, in which inmates were discharged and why, what kind of jobs were done by inmates, what kind of punishments were dealt out, and what kind of medical issues were occurring in the time span of the reports. Places that held people in relatively close proximity, such as prisons, were a particularly good source of gauging population issues of the day, such as prevalent and dangerous diseases, what crimes were more widespread than others, and how gender was viewed. Interestingly, this very small series manages to provide information on all of the above issues. I'm going to take you on a quick tour of these records and show you the minimum of the information you can find in these because there is so much, but we'll begin with the convict schedule, which shows the information on inmates who were newly imprisoned during that quarter. As you can see, the typical schedule can show the name, age, race, and gender of the convict, as well as their country of origin, their occupation prior to internment, the crime they committed, when they began their sentence, and what they were sentenced to. But as I said, this is far from the full schedule and the information that can be gathered from it. As with the convict schedule, the discharge statements are full of information on the background of a convict, but obviously this is a much smaller set of information because it only documents the inmates that were discharged or deceased in the particular quarter of the report. It documents several types of information such as biographical information, information about their time in prison, and why they were released. This section of the report is a lot more simple and only documents the types of jobs being done in the prison and how many inmates are performing these jobs. The interesting distinguishing between male and female convicts is telling, and also highlights the population gender discrepancy in prisons at the time. This section is likely due to the functions of the Board of Public Charities, which monitored the welfare of the population. This form would show the types of punishment and the amount of times these were doled to unruly prisoners. However, whether these were considered humane punishments at the time might have been a determination made beyond the creation of these records. For being a smaller section, this one could say a lot. It is compiled of two lists, one which states the types of diseases treated over the course of the quarter, and the inmate population that was treated, and the other which states the types of diseases that were still being treated at the end of the quarter. Both the types of diseases and the population afflicted with said diseases decreased dramatically from the first list to the second, a bit of information that could be researched against the discharge statement to determine how good healthcare was in the penitentiaries. If you're interested in looking at these records for a project, or just out of curiosity, I encourage you to please contact us to set up an appointment by following the instructions above. Our dedicated staff will work with you so you can look through the records you want in our holdings. Thank you very much for listening, and we hope to see you soon.